Hello, I'm Dr. Trites. If you're watching this video, most likely you have a child who is obese. Maybe you've looked for some conventional approaches. Maybe you're wondering if there's a better, more natural way to deal with it. As a functional medicine practitioner, I work with a lot of people who have obese children. In fact, I have one too. I can tell you through personal experience there is so much more that can be done to heal and improve the quality of your child's life. The conventional approach to childhood obesity is to do nothing, don't change the diet, or prescribe some expensive and possibly dangerous anti-inflammatory or immunosuppressive drugs that have dangerous side effects, or to do bariatric surgery, something that should be reserved for somebody in their late 40s and 50s or even older. The problem with these conventional approaches is they do not address the root cause of why your child is gaining weight and becoming obese in the first place. To really heal, your child needs a different approach. There are several root causes of childhood obesity. Your child's trigger could be too high or too low blood sugar, poor gut health, so they're not absorbing their food or putting it where it needs to go, hormone imbalances, overloads of toxins, metals, chemicals, too much stress, infections, or food sensitivities. Your child, and you know at home, the anguish that goes with being overweight. And what children do to other children is frankly awful, but your child does not have to live with it. Right now you have a choice. You came looking for help. You came looking for a reason and you found me. You can continue with the conventional approach, and in a year you might be where you are now with your child, or your child is worse. If you do nothing, the roots that drive your child's obesity will still be there. So the longer you wait, the harder it's going to be. Now, I'm a realist. It's very hard to draw blood on children. Not all of them love it. But we do need a baseline for the most part, and if there's other baselines, we can utilize the previous doctor's information. For the most part, we use saliva and urine. Very easy to get, and most children are compliant with that. I treat patients from all over the United States. I have a practice in Dallas, Texas, and I see people online. So no matter where you are, if you can get online, you can meet with me. When we meet, I do what's called a root cause assessment. We will systematically identify the triggers of your child's obesity and create a customized plan for them to heal. Don't wait for your child to have a better life. Work with me now and find out what triggers your child's obesity. If you're ready to stop suffering, I invite you, please schedule your 30-minute appointment and work with me now. If you still have questions on whether or not I can help your child, I also offer a free 15-minute consultation with my assistant, and you can get all your questions answered on how we can work together. Click the link below to get started. Don't wait for your child to have a better life. Work with me now and find out what triggers your child's obesity. If you're ready for your child to stop suffering, I ask you, please schedule your 30-minute appointment with me